Hello, Namaste. I'm Dr. Amit. So we have completed our video on tissue distribution of adrenergic receptor and tissue distribution of cholinergic receptor. Now we'll move forward and today we'll talk about tissue distribution of dopamine receptor and how it works in different parts of our body. So let's talk about tissue distribution of dopamine receptors. Okay. So before we begin, let's have a quick and a brief introduction about dopamine. Okay. So dopamine is a neurotransmitter and it's a precursor of norepinephrine and epinephrine. So as we all know from our biochemistry that phenylalanine form tyrosine, after then that will form dopamine, after then norepinephrine and epinephrine. That's why we also call dopamine as a precursor of norepinephrine and epinephrine. So what's the important role, how dopamine helps in our body? So it actually helps in the movement of our body, it helps in motivation and reward, and it helps in hormone regulations and kidney blood flow. Now we'll talk how it actually helps in details. Okay, so we'll talk and we'll focus on D1 and D2 receptors. Okay, so this dopamine receptor is also a G protein coupled receptor. It means that G protein get activated, then secondary messenger activates, after then the tissue response occur. Okay, so this when the D1 receptor get stimulates or activated, it increases camp, and when D2 receptor get activated in our body, it inhibits and decreases camp. Okay, so first let's talk about D1 receptor. Okay, so this D1 receptor, we as we already talked that it increases camp, so it increases the intracellular camps. Okay, so in the cell, suppose this is a cell, then over here the camp will increases. Okay, now what are these major locations where it actually found? So it is found in renal blood vessels. Okay, so the blood vessels present in the kidney, there is presence of D1 receptor. Then in the mesenteric blood vessels, in the mesentery also, then the coronary blood vessels of our heart, and in the basal ganglia. Okay, in the direct pathway, in basal ganglia there actually form two pathway, one is direct pathway and one is indirect pathway. So it is present in the direct pathways. Okay, so in D1 receptor is present in the direct pathway of basal ganglia. So now let's see how it happens, what happens in the respective locations. Okay, so let's first talk about kidney. Okay, so in kidney it causes renal vasodilations. Okay, so how actually it causes renal vasodilation, we'll look here. Okay, so when the dopamine, that D1 binds to the renal vascular muscles. Okay, so suppose this is the blood vessels of the renal system, and over here there is a D1 receptor. Okay, so when dopamine bind to these D1 receptors, then the GS protein get activated, then we all know that camp get increases, and this will cause the smooth muscles. Okay, the smooth muscles of these blood vessels to relax. Okay, and then what happen if the smooth muscles get relaxed, then the blood vessels will dilate, so the renal blood vessels will dilate and the renal blood flow increases. So why this actually happen? So suppose during stress or then during any conditions where the renal perfusion decreases. Okay, suppose this is our kidney. Okay, and the kidney blood flow decreases in any conditions. So in that conditions, kidney still need oxygen and blood supply. So the D1 ensure that there will be adequate perfusion. So in those conditions, the D1 get activated, it dilate the blood vessels of the kidney, and it just ensure that a proper perfusion is occurring in the kidney. So this is how D1 receptors works on the kidney. So we'll continue that same clinical correlations. Okay, so in the past, in the past days, low dose of dopamine used to give to increase the blood flow, but according to our modern study, okay, it is no longer recommended because it doesn't improve the kidney functions. Okay, so this is all about the kidney, how D1 works in the kidney. Okay, now let's talk about brain. Okay, so we know that in basal ganglia it works in the direct pathway of the striatum. Okay, so first understand what is the direct pathway. Okay, so let's make it simple. Okay, so the basal ganglia in our brain, it controls the voluntary movement. Suppose we need to raise our hand or raise our leg, those voluntary movements are controlled over here. So this our brain actually consists of two systems. Okay, one is direct pathway and one is indirect pathway. So the direct pathway actually promotes the movement. Whatever movement we do, it promotes the movement, and the indirect pathway actually suppresses the movement. It actually apply the brake, okay, over the movement. Okay, and it both works with the help of dopamine. So how actually it works, let's see. So when the dopamine act on D1 receptor, so we know that we have D1 and D2 receptors. So when the dopamine is bind to D1 receptor in the direct pathway, it stimulates the accelerator. Okay, so suppose this is a direct pathway, suppose, okay, and there is a receptor called D1 receptor. Okay, when dopamine will bind, suppose this is a dopamine, it gets bind to it, then it will accelerate it. It means it increases the speed. Okay, and the movements become easier because someone is accelerating you, so the movement is becoming easier. Okay, so suppose that there is a cup of tea on the table. Okay, and if you decide to pick up a cup of coffee or tea, then the direct pathway will helps you to initiate smoothly. Or suppose this is a pen, if I want to uh, pick up this pen smoothly, then the direct pathway is helping me. Okay, so how what's the clinical correlation? So over here, okay, we'll see. Suppose in a Parkinson's disease, okay, in Parkinson's disease actually what happened, that in substantia nigra the dopamine producing neurons get degenerate. Okay, so dopamine producing neurons in the substantia nigra degenerate. So if dopamine producing neurons get degenerate, then there will be less dopamine. So if there is less dopamine, then the D1 stimulation will not occur. So it means that there is no one to accelerate the movement. That's why the patient moves slowly. Okay, so the Parkinson disease patient actually moves slowly. Why? Because there is no dopamine producing neurons. Okay, so this is how it actually helps. So, in Parkinson's disease, the symptoms like bradykinesia, rigidity, or resting tremor, or shuffling gait. So, what actually we do? So, in treatment, we give levodopa. So, what actually happened? So, this levodopa is converted to dopamine inside the brain, and those dopamine, now what will happen? Those dopamine will act on this levodopa will convert into dopamine, and this dopamine will act on this D1 receptor, and it will now accelerate the movement, and it will improves the bradykinesia, rigidity, resting tremor, and shuffling gait. Okay, so this is how D1 receptors works, or clinical correlations of D1 receptor in Parkinson's disease. Okay, now let's talk about D2 receptor. Okay, so D2 receptors are also G protein coupled receptor, but it is in the GI class. Okay, and from our very first topic, okay, we know that the D2 receptor inhibits or decreases the camp is decreasing over here. Okay, so the D2 receptors are linked to GI protein and it decreases the camp. Now we'll see where it is located. So it is located in our brain, then in presynaptic terminals. Okay, we all know that, suppose this is a nerve. Okay, so this is called presynaptic and this is called postsynaptic. So in the presynaptic terminal it is located D2, then in the brain in the pituitary gland, and in basal ganglia, that is indirect pathway. Okay, so as we know that in direct pathway D1 is working, and in indirect pathway D2 is working. Okay, so now we are talking about D2 receptor. Now we will see that how these D2 receptors work in presynaptic nerve terminals. Okay, so as we all know that, suppose this is a nerve, then this is a presynaptic nerve terminal, and this is a postsynaptic nerve terminal. Okay, so it helps to regulate the neurotransmitter, because we all know that neurotransmitter get released. Okay, neurotransmitter get released over here in the synapse, and it works. So it actually regulate the release. How? Actually, suppose this is your nerve terminals, and dopamine is getting released from here. Okay, so same dopamine binds to D2 receptor on the same neuron. Okay, so suppose this is a presynaptic neuron, then in presynaptic neuron there is a receptor called D2 receptor. So when if more dopamine is released over here, then this dopamine will go and bind to these two receptors and will tell that please don't release now dopamine, enough dopamine has already been released. So this is how same dopamine binds to a D2 receptor on the same neuron and act like a feedback signal. What feedback signal? Now this dopamine will tell neuron that enough dopamine has been released, please slow down, not release further, and this is a negative feedback. Okay, so this is how it works in the presynaptic nerve terminal. Then what's its clinical significance? Its clinical significance is, we all know a disease called schizophrenia. In schizophrenia, what actually happened? In mesolimbic system, there will be a lot of dopamine released. Okay, so we give antipsychotic drugs like haloperidol, risperidone, or olanzapine, and these what actually do that these drugs bind to the D2 receptors present in the post-terminal, okay, not pre-terminals, and over here also, and this will block the D2 to release excess dopamine activity in schizophrenia. Now let's understand with this picture. Okay, suppose this is a presynaptic terminal and postsynaptic terminal of a schizophrenic person. Okay, so more and more dopamine is releasing and more effect will come. Okay, so if more effect will come, then it will more increases the symptoms of schizophrenia. So in those patients, if we'll give a drug called haloperidol or risperidone or olanzapine, then these drugs will bind to these D2 receptors. Okay, and when these drugs will bind to this D2 receptor, they don't let this dopamine to bind over here. And when these dopamines will not bind to these D2 receptors, then the effect will decrease. So this is how these antipsychotic drugs works in case of schizophrenia. So that's this is simply a clinical significance that in schizophrenia the dopamine get increases. So we give drugs like haloperidol, risperidone, or olanzapine. Okay, and these drugs go and bind to the D2 receptors in the postsynaptic terminals and over here also, and this will not let bind this dopamine releasing from the presynaptic on this, and the symptoms will get decreased like hallucinations, after then delusions or disorganized thinking. Now let's see how these dopamine receptor D2 receptors works in the brain in indirect pathway. So in our first page we saw that there is a direct pathway which promotes the movement, and there is an indirect pathway in the brain which suppresses the movement, and over here D2 receptor is present. Okay, so we'll now see that. Okay, in brain there is an indirect pathway that over where D2 receptor is present. So what actually happened? The direct pathway stimulates, but the indirect pathway actually inhibits. Okay, normally it prevents the excessive movement. Okay, so if any excessive movement is there, then the brake will be applied. So what actually happened? Dopamine bind to D2 receptor. Suppose this is a dopamine. Okay, and this dopamine will go and bind to these D2 receptors in the brain in the indirect pathway, and it will inhibits the brake. Okay, suppose there is a brake, then that will inhibit the brake system and it will makes the movement easier. Okay, now let's understand with this photo. Okay, suppose these are wheels. Okay, now and there is on these wheels there is a D2 receptors. Okay, so suppose when dopamine bind to these D2 receptors, then the brake, suppose this is a brake system, the brake will release and the wheel will start moving faster. But when the dopamine will not bind to these receptors, then the wheel will not move because there is no one to stop the brake. Okay, so when dopamine bind to these receptors in indirect pathway, it will inhibits the brake, that it will tell brake that don't put brake on the wheels, and the movement become easier. So let's understand this clinically. Okay, we all know that there is a disease called Parkinson disease. Okay, in Parkinson disease there is decrease in dopamine. Okay, so when there is decrease in dopamine, then two things will happen. We all know there is a D1 and D2 receptors. So D1 receptor will accelerate the movement. So when there will be no dopamine, then there will be no action of D1, so it will become weak. It means there will be no accelerations, so the movement will be slow. Now in D2 receptor also we need dopamine to act, so becomes overactive because there is no dopamine in the Parkinson disease. So if there is no dopamine, then there will be no one to say that brake that please don't apply. So what will happen? The brake will apply more on the wheel, so there will be the D2 receptors become more active because dopamine no more inhibiting it. So what will happen? The patient will be rigid because more and more brake is applied, so the patient becomes slow and rigid. So this is why Parkinson disease causes difficulty initiating any movement. Okay, so this is actually the pathway. Now we'll see how these D2 receptors and dopamine works on D2 receptor in pituitary gland. Okay, so in pituitary gland, D2 receptors present on the lactotrope cells of anterior pituitary. Okay, so we all know that in pituitary gland there is anterior and posterior pituitary. Okay, so on the anterior pituitary there is D2 receptors. So when dopamine bind to these D2 receptors, it will inhibit the prolactin secretions. Okay, so when prolactin secretion will when this dopamine will inhibit, then prolactin secretion will decrease. So what will happen? So now let's see it clinically. Okay, so if D2 receptors get blocked, okay, suppose the D2 receptors of the anterior pituitary get blocked like by drugs like antipsychotic, then what will happen? Normally when these D2 receptors are getting activated, prolactin secretion decreases. But when these receptors get blocked, then prolactin secretion will increase. When prolactin secretion will increase in the patient, then there will be galactorrhea, there will be amenorrhea, the patient will have infertility, the patient will have gynecomastia, and the patient will develop sexual dysfunction. Okay, so if we are giving any drugs that will inhibit D2 receptors, okay, then it will increases the prolactin, and if the prolactin will increase, the patient will develop these symptoms. Now let's see a treatment. Okay, suppose if any patient is having prolactinoma, okay, more and more prolactin is producing in their body, or hyperprolactinemia, then in those conditions we give drugs like cabergoline or bromocriptine. Why? Actually what happened, these drugs are D2 agonist. So in prolactinema or hyperprolactinemia, what's happening, this prolactin secretion is getting increases. So in those patients we need to decrease this secretion. So to decrease the secretion, we need to increase the activity of dopamine on the D2 receptors. So we give a drug which is agonist to these receptors, that is cabergoline and bromocriptine, that will stimulate the D2 receptors, and that will decrease the prolactin secretion in those patients. Okay, so this is how it works in the pituitary gland. So this is all about dopamine receptor. At last I'll just revise once more because many students get confused in this part. Okay, that what actually happening in the indirect pathway, of D2. Okay, so just remember this figure. Okay, suppose these are the two wheels. Okay, on the wheels there are receptors called D2, and on these D2 receptors dopamine works. Okay, so what actually happening is, when this dopamine bind to these receptors, this will inhibit the brake, that the brake will not applied, so the wheels will run faster. But if there is, in any conditions, if dopamine is decreased, then the brake will apply continuously and the wheel will not move. So in case of Parkinson's disease, there will be dopamine decrease. That's why when dopamine is decreased, the D1 and D2 will not work, because there is no dopamine. So if D1 will not work, so the patient movement will be slow, and if D2 will not work, then what will happen, the brake is getting continuously applied and the movement will be rigid. That's why the Parkinson's disease causes difficulty initiating movement. Okay, so this is all about the dopamine receptors. So this is all about the dopamine receptors, and in the next video we'll talk about another receptor from the pharmacology. So if you like this video, please share with your fellow medicals and subscribe to my YouTube channel and like my Instagram page. Thank you for watching.